great audience here. So we're going to start off first by showing a pretty simulation about eCPR, and we'll use this to start talking about to generate some questions and discussion. There's no audio?
Now other sounds are playing.
You want to try to narrate this? Or I guess you can't, huh? I can.
Yeah, so I can give some brief narrative on this. So this was the insight to eCPR simulation we did at our children's hospital, PICU. We had a scenario, 8-year-old male who was brought in with status asthmaticus, intubated and on the ventilator, kept deteriorating and had hypoxemic bradycardia with arrest. And so in the scenario, the goal was to have the team start CPR and then think about Ecmo activation. And so focusing on the process of Ecmo activation and then working with the surgeon, how the CPR team worked with them in coordination to minimize interruptions while the cannulation was happening in the neck. And then at the end of the scenario, we had 45 minutes of debriefing where we involved not only the PICU team but also the perfusionists, the surgeons, everybody was there, and we actually did a video debriefing. So we showed the entire video and we went step by step on what went well, what could have been done better, and then ultimately discussion about teamwork, communication, and the activation process. So this is kind of an example of the eCPR simulation which we have started doing at our center, and the key things we want to bring is how we build this Ecmo simulation curriculum. I think it wasn't easy because we had to involve a lot of different team members. We had to make it as realistic as possible, so we chose the right place, which was the ICU rather than the sim center. And we created a mannequin with in which the surgeons could actually cut down the tissues and open the vessels and cannulate the vessels. So we had a lot of help from our simulation technician who helped us create this special mannequin. And we were able to actually connect to the Ecmo and have the blood flowing into the mannequin and out into the Ecmo circuit.
So this is a pretty sophisticated Ecmo simulation. It takes a lot of time to get here, but so my basic question is, like, we have a huge audience here. Why would all of you recommend developing some type of Ecmo simulation program to help train their teams?
So I think when it comes to why do you need this type of training, why do you need simulation, the key thing is there are several aspects of simulation training. One is you want to create a realistic scenario so you can bring all the team members working together just like in a real scenario and learn from their mistakes, learn from each other. And because we do not do a lot of ECMOs, a lot of times when you don't do something more often, you tend to forget. There is less of muscle memory. And so in order to have people ready for the actual event, simulation is one of the ways you can prepare them to be ready for the actual event. And that's why we do simulation. It helps us keep us ready for these types of events which are not very common, not day-to-day practice, and it allows everybody to work together to understand how the team would work.
Well, I mean, simulation is a buzzword nowadays, isn't it? So everybody says simulation, simulation. I mean, it's not actually new. It's been going on for ages. If even you look at the prehistorical era of Indian mythology, or the corporal punishment used to be cutting the nose. So the surgeon that time take a leaf and cut and prepare what the skin they have to do. So, but now it has come with the new flavors, new technology. Well, why? I mean, my answer to the question, Mark's question is, why simulation-based learning is important for Ecmo is, the adults are very smart learners. They are experiential learners, and we are reflective learners. If we experience something, then we're likely to learn from out of that, provided you are facilitated to learn. Okay? So, and also adult learners are, they choose what they want to learn. So because you are all Ecmo specialists here, if somebody comes and talks to you about biophysics, you wouldn't be interested. You will just walk out. And you will also not based on the subject. Probably you are problem-based learners. And this experience, whenever we experience something, if you reflect on it, then you tend to get better, provided you want to change for the right way. But that experience in real time or real experience can be costly to the patient outcome and the patient safety, patient quality of care. So simulation gives that, that environment where you can simulate. But having said that, even the real experience can also be learned, debriefed and learned to get better. We do all the time. We don't know that we do that. That's why I strongly feel the simulation has got a lot to play role in variety of arenas. I will come back, but I won't dwell on it at the moment.
The question is why simulation, right? For ECMO. I think, other than what my friends have talked, one of the things I would say is that if you are a low volume center and you need to keep all your specialists up to date with the technique and knowledge and comfort level, it's better to have a simulation, because if you do 5 to 10 ECMO runs a year and you have 20 ECMO specialists, they may not all get the right number of hours sit at the bedside to gain the experience. So this usually serves as a surrogate for actual bedside learning. And that brings out to the important point of that you need to have two things. One, you should have this scenario as realistic as possible. Cannot just make it all the patients die and have a massive cardiac arrest, and that's not how it should be. It should be very realistic, and then there should be also buy-in from the learners that they are learning in a realistic environment. So that's why the ECMO simulation is probably useful from my point of view, is that if you don't do enough, then you're not going to be good at it. So this serves as a surrogate for actual clinical experience.